right, you guys are live.
Okay, so welcome everybody to the City of Leduc's third virtual town hall for local businesses. We're going to share some opinions, concerns, challenges, and hopefully answer some questions tonight. And we hopefully will have relevant information that we know will be useful as the COVID-19 pandemic continues. So tonight, we're very fortunate to have with us our Leduc Beaumont MLA, Brad Rutherford, Dr. Christopher Sakura, the Medical Officer of Health for the Edmonton Zone for Alberta Health Services, Ken Cobley, the President and CEO of Alberta Chambers of Commerce, Jody Kessler, the Manager of Community and Service Excellence for TELUS, Shadia Musa, owner of Leduc Cinemas, Melissa Lenos, the owner of King Business Solutions and a board member on the Downtown Business Association, and Jennifer Garys, our Executive Director for the Leduc, Nisku, and Wetaskiwin Regional Chamber of Commerce. We also have our City Leduc Manager of Economic Development, Harold Wilson. So I want to thank everyone for joining us tonight and providing your support for our local business community. We have an amazing panel tonight, and I'm looking forward to being able to answer some questions here. So there will be several brief presentations before we move into the Q&A. MLA Rutherford will speak first in a few moments, and then we'll listen to Shadia Musa, then Dr. Sakura, Ken Cobley, Melissa Lenos, and finally from Jody Kessler. After that, a Q&A period question and answer period will follow, and you can enter your comments or in the Q&A box located along the taskbar at the bottom of your screen. We've also had some questions in advance prior to tonight's session, so we'll be including those as well. Natalie will read out the questions for the panel, and we'll do our best to offer a relevant response. If we're not able to answer the question tonight, we'll follow up via email in the next few days. So we're really thankful to our partners on the Economic Support and Recovery Task Force, the Downtown Business Association, the Leduc, Nisku, and Wetaskiwin Regional Chamber of Commerce, for their ongoing collaboration as we collectively respond to the challenges being addressed by our business community due to the pandemic. So on behalf of the task force, Leduc City Council and City Administration, please know that we appreciate all that you do to build connection and culture in our community, and that we are here to help in any way we are able to tonight. We hope to hear from as many people as possible and to learn about challenges, answer your questions, and to share ideas to help us all continue to press forward. As always, the town hall is an opportunity for you to be heard. So thank you again for joining us and taking part in this discussion. And now I'll hand things over to MLA Rutherford.
Thank you, Mayor Young. I appreciate the city putting this on and all the participants on the panel today. And I want to just make sure that I say thank you to everybody who's on this call, but all the business owners out there who have put in a huge amount of effort to get through the pandemic to date. And I understand that, of course, there are some businesses who are still heavily restricted or are required to be closed. I have advocated for you to government. I know I've spoke to Shadia on the phone and talked about her particular situation and brought that forward to government to consider easing restrictions on Leduc Cinemas as an example. But I wanted to make sure that that the business owners knew that I'm not going to the government saying get rid of every restriction, and I get phone calls that ask for that. But I also get phone calls that say the exact opposite, that people want more restrictions. So that there is really a mix that comes into this office of opinions on how to address a pandemic. And I want to make sure that you know that one of my overarching messages to the government is making sure that we're setting up people to succeed. Now, I know the health minister has talked about June being an opportunity when everybody who would like a first dose, would be eligible for one. And that depends on a schedule of delivery being met as well. So there are some caveats to that. But in my point of view, we've got a couple more months where this is not going to be easy, but that doesn't mean that we can't help people set up to succeed through this. and to make considerations for those remaining small businesses that are still closed to be able to open and generate revenue, for example. Now, I'm not talking about nightclubs, I'm not talking about stadium seating, things like that, but the businesses that can open safely and operate and get a chance to generate revenue, like I mentioned. Mid-April is going to have an opening for an enhanced COVID-19 business benefit, an additional 10,000 on top of the 20 that the province has offered. So when that opens, please apply for it. And if you have any difficulties with it, please reach out to our office for assistance. We have had folks be successful with some of the grant applications within a day or two, and some that get stalled out for weeks. Please reach out. If things are not going on the time frame that you would expect, please let our office know. And just, Mary Young, please wave when you want me to stop talking. So I could go on for a while. I just want folks to know that the vaccinations, it was commented on earlier, it's a race. It's a race to get the vaccinations out. There are other countries that are well ahead of us. And I know you're going to see them begin to open a little bit quicker. And you're going to, like, especially for the United States, there's about a dozen US states now that will offer the vaccinations to 16 and up, regardless of any other conditions. So it's just that there's an availability there. They're around 40% of their population. They are well ahead of us. We're around 14th or 64th in the world. So we are dependent on the federal government getting us that inventory. And I've been assured, and the province has talked about this, to us privately and publicly, that they are ready to administer those doses when they get them, which is important as well. So those are just a couple of things I wanted to touch on. I know there's going to be lots of questions, so I won't try to touch on everything right at the beginning, but I appreciate this opportunity.
Thanks, Brad. Shadia?
Thank you. Thanks very much. First of all, I just want to say thank you to the Chamber. Thank you to the panel for allowing me to join you this evening, and a special thank you to our local Chamber team for all you do. You guys are an incredible group of people. Your devotion and dedication to our community shows in everything you do. So thank you so much for your support. It's always appreciated. I know this has been an extremely challenging year for all of us. Everyone's health and safety is of utmost importance. I do understand the difficulty it has created for the government, for healthcare workers and essential workers, for everyone. Just as other small businesses, my businesses are my livelihood. I've poured myself into growing them, to being successful theaters, providing for my family, connecting with my community, and providing employment for 44 Albertans and continuing to contribute to our economy. I take so much pride in being an important part of my community and the movement in safety. I realize that there needs to be a balance in place between protecting our citizens, our healthcare system, and our economy. And with that, I've complied with the closure and taken all necessary actions to ensure that everyone's health, safety is very well cared for. And I have to say, my team of staff have done an incredible job while we were open for regular operations. And of course, with our curbside popcorn sales, they've done a fantastic job. The industry as a whole has collectively operated following not only the guidelines of AHS, but have also taken safety and extra measures, knowing how theaters should be run and becoming creative in executing our operations. As a president of the Motion Picture Theatre Association of Alberta, I've personally sat on the National Association's Task Force Board in support of all theatres. And I've also taken part in helping craft the guidelines that were presented to AHS and that were accepted and used to create the regulations that AHS had finalized and required us to follow back in June. Sectors that are deemed non-essential have been granted permission to open, and I just can't seem to understand the reasoning and common sense in other sectors that have been permitted to operate and operate at full capacity, and large retail permitted to operate at an increased capacity, and movie theaters are at a very low risk and not permitted to operate at all. And I feel like our industry has been categorized unfairly. So the decision to allow hundreds to shop and eat indoors, but not to let anyone sit quietly in a socially distanced cinema in a sedentary environment doesn't seem like a scientific decision. So more than 1 million Canadians went back to the movies in 2020 in Canada, with 0 cases of COVID-19 tracing back to cinema environments. Currently, Quebec allows up to 250 people per auditorium. For reasons unknown to me and unknown to the industry and unknown to the customers, we just feel like the government has made a choice and maybe not seeing the science or looking at the reports, and it's leaving me feel a little bit stigmatized. And I don't know, I guess I'm going to say I feel discriminated against. Back in June, Alberta theaters were permitted to operate with a maximum of 100 people per auditorium, as long as they were socially distanced and protocols were followed. In our largest auditorium of 283 seats, using the appropriate safety measures and social distancing, we could only fit a maximum of 50 guests. That's with each family sitting together, and every group was socially distanced, seated socially distanced, so which made it safer. I'm not advocating against any other businesses, not at all. All I'm only looking at this on a relative basis and just trying to understand how these decisions are made. If I look at restaurants, pubs, food courts permitted to operate at full capacity with folks from different households with masks off, allowed to carry on conversation, large retail and big box stores permitted to operate with minimal control and permission to sit on an airplane for a number of hours beside a complete stranger, how come a movie theater can't open? I'm just trying to understand on what basis these decisions are made. If you don't mind, I would love to share a little bit on how we're operating using our specific protocols with COVID regulations. So we have the capability to predict and control the traffic flows of our patrons. As the guests arrive, they'll find 6-foot distance stickers, large yellow ones on the floor, and big specific barriers and hand sanitizing stations. One of our staff members ensures that all of the guests are following social distance protocols. At the counters, they'll be greeted by our friendly team at admission behind plexiglass and wearing masks. We encourage everyone to pay by card. However, if anyone wants to pay by cash, we hand them a basket. They place the cash inside. We spray the disinfectant and clean it before accepting the money. And we do the same on the return to return anyone any change. We have barriers and signage that guide customers through the concession and to the 2 cash registers, which are separated at least at a 12-foot distance at the counter. At the auditorium doors, our guests are guided 1 family at a time, and their seating is assigned by an usher. So an usher will guide them in and seat them. When the movie is done, our ushers will guide each row out 1 at a time, and they exit out the back directly into the parking lot. This way, there's no congregation of guests in the lobby. And then we disinfect and sanitize all chairs, cup holders, armrests, sweep, mop, throw out the garbage, and allow enough time in between shows to ensure we can clean thoroughly. We have specific staff members on duty that are specific to cleaning only, and all high touch points are cleaned frequently. We then open for the next showtime. So sitting in the auditorium is very sedentary. All guests are facing one direction with no conversation, each family sitting separate from one another. There's very little opportunity for any droplet exchange. Our ceilings are very high. We have an HVAC system in every auditorium, just like all theaters. We have big buildings. These aren't high density operations when you take the capacity out and when we stagger the show times and control our patron flows like we do. And with our staggered show times, people don't overlap on arrival and departure. So theaters are well positioned to provide distancing at all the steps of the movie-going experience. We are built for high volume, but when you take the volume out and we spread the show times, we can control the experience in a remarkable way. When we were permitted to reopen back in June 2020, our customers slowly began to come to the movies. The trust and the confidence began to grow, and the community was so happy coming to a safe environment. We needed to give our community a sense of normalcy, and movie going is a perfect activity that gives a family a sense of comfort and also allows them to disconnect from our global crisis for a while. So my perspective is one of frustration and real disappointment in how our business and industry is being framed in the reopening stages and being deemed high risk. With 0 cases of COVID-19 being spread in cinemas across all of Canada, I just can't seem to see how the decisions are based on data, evidence, and science. I would really like to ask and get an explanation as to why we are being categorized in the way we are. To be creative, we've been selling our famous popcorn curbside and for takeout 2 nights a week. It keeps us connected to our community, and the community is extremely supportive. It's wonderful to see everyone coming in for popcorn. 9 out of 10 customers ask me the same question. Shadia, when are you ever going to be allowed to open? We need the movies. We miss this place. We know our safety is in good hands here. Please, please see what you can do to reopen. The popcorn sales are a blessing, but in no way are they covering our costs and definitely not financially viable. I miss my staff misses work, and laying off 44 people was very difficult. It was really, really emotional for me, and it still is. It's their livelihoods that are at risk too. You know, I really appreciate all of the support that government has given. Everything that we've received has been very helpful. For that, I'm very grateful. It's just not enough. And it's a real struggle. So I'd like to just ask the question, why are movie theaters being categorized as they are? And why are other sectors being granted permission to open and movie theaters are not? I can certainly understand if all sectors were mandated closed, I would have no problem staying closed at all. At that point, we would all be treated fairly if that was the case. So just to jump to another note, I think probably my time is up, so I won't keep you too much longer, but I do want to share something that maybe some other restaurants should keep in mind. We've been on Skip the Dishes for about 2.5 years, and sadly we learned that they've been taking advantage of us and charging me well over what was in our agreement. So unfortunately, it's forced me to shut down the service for now. So I apologize to all of you who have loved having that service, and it's no longer in place for the time being. I just urge you to please check your monthly reports and payouts and make sure that you aren't being overcharged like I've been. We are now looking forward to partnering with Ikari, which is a new delivery service only local to Leduc, and it's a service built by local Leduc citizens. So it will be new for us, and we look forward to the new partnership with them. So please watch for that. Once again, thank you so much for your time. Thank you for allowing me the opportunity to share my concerns. Thank you to the Chamber, and thank you to the community for all of your support. I just can't wait, and I know my team can't wait to welcome you all back to the movies. Thank you so much for the time. I really appreciate it.
And thank you, Shadia. You know, it's during the pandemic, there's so many stories like yours, and I just wish there was something I could do, but hopefully Dr. Sakura and Brad here will be able to have some inputs. Not a good leadway into you, Dr. Sakura, but I suppose you're probably used to it by now with many of the stories through the pandemic.
Well, certainly, and Shadia, thank you very much for sharing your story. I certainly do appreciate the movie-going experience. It's something that does bring family together. The guidance is set out by our partners at Alberta Health, so they actually set the guidance on Alberta Health Services. And from my understanding and my read of what the overall plan is, they are intending movie theaters and other auditorium type events to be in the phase 3 relaunch, which is, well, they've set the tentative guidance on that at looking at hospitalizations of around 300. They may consider partial reopenings in some of those environments. And we aren't quite there yet. We're still in a phase 2 from a provincial relaunch approach. The questions you're asking are absolutely perfectly reasonable ones. And certainly what we typically recommend is that those questions are often best raised at the Wednesday discussions that are had between our Chief Medical Officer of Health and our municipalities. And because ultimately, from that provincial viewpoint, those are big questions that aren't just relevant in Leduc, but they're relevant in all of the other environments. So they at the Alberta Health environment have the unenviable task of trying to set policy for an entire province, and they have many things to take into consideration. And I don't envy them that task. Would you want me to provide a little bit of presentation?
Yeah, you were going to do your presentation now, Dr. Sakura?
Sure, if that's all right.
Yeah.
Look at that. Thank you very much for driving. We'll go on to the next slide. Perhaps what we'll try to explore. The second slide, please. Okay, thank you. All right. What I hope to cover and perhaps introduce is where we were. So just a little bit of a brief history of what has happened, where we are right now, where we're going, and then what can we all do to help. The next slide. From a global context perspective, we've been in this just over a year. The first Alberta case that was reminded was March 5th, 2020. We've had almost 128 million cases around the world. And that's a huge number. When we look historically at what's happened in Alberta, can we get the next slide? We look at an expansion of COVID-19 over the past year, and this is just long-term care facility active cases and the number of outbreaks in that bottom line. This portrays our experience with COVID-19. Having large daily active cases, mainly within the broad population, but also within our long-term care sites themselves. And we see a little glimmer of hope in here. That 92% decrease at the very end is shortly after we were able to initiate an immunization program. The next slide. And very similar in these designated supported living environments, we've seen a very similar decrease overall. So we see this large expansion of COVID-19, we see a contraction. And vaccine works. Vaccine is very protective. It does help for our supported living environments, return them back to more normal conditions. We're still taking all those precautions around masking, eye protection, the hand hygiene things, but they are an important part. Immunization is an important part of where we're going. The next slide. When we look at the Alberta cases and the Alberta context right now, we have current, and this I apologize, this is a March 9th graph, but presently we have 300 current hospitalizations in Alberta. We have 58 in intensive care unit, and our total deaths from COVID-19 over our past year has been just under 2,000, around 1,987. Alberta right now has 8,000 active cases, and our present positive off of the 7-day average is just under 6%. It's 5.96. Average age of death is 81 years. So the next slide. This may look like a very busy graph, but if you squint and close your eyes, you can see the general shape of it. The general shape is the important part. We see that small blip over May last year. We see some grumbling along. We see that large rise over November to January, just several months ago. And these are all confirmed cases of COVID-19. We rode that peak down over January to February, and we see an increase. We see that rise from a number of active cases, at least identified cases on a per day basis, from a low of around 250 to 300 per day over the first part of March to now we're getting 600 to 700 cases per day. So we're seeing a large increase. And that increase is part of the story. The next slide. What we've seen is something called variants of concern. So COVID-19 being a virus does mutate over time. They can change in ways that are very unfortunate. So what we've identified in the Alberta context is a large increase in what are called a variant of concern or variants of concern that are more easily transmitted from person to person, which means they can be spread more easily. And they're also more deadly. So they cause more disability, more death. Because they do spread more easily, there is a concern that they will be more prevalent or more common within our population. Get the next slide. And certainly that has been what we've seen. Since we've started doing VOC or variant of concern testing on all samples or all positive samples, we've seen this large increase of variants of concern overall within the Alberta environment. I believe we're just over 20% of all positive COVID cases are variants of concern, and those variants that cause more death and disability and are more easily transmitted. The next slide. We're doing a number of things around this. So surveillance, absolutely. We're doing modified contact tracing and isolation, travel restriction and testing, at least from those federal quarantine environments, and immunization. So we are in this race against expansion of COVID-19, the influx of the variants of concern, and then the immunization programs that will counter that. We see the effect of immunization in our long-term cares and our continuing care environments. And as supply of vaccine is maintained and will expand over time, we hope to see that exact same effect across the population. Thankfully, those same measures that protect all of us against COVID-19 also protect you from the COVID-19 variant of concern. So the consistent messaging around hand washing, no touching your face, your eyes, and your nose and your mouth, staying home when you're sick, getting tested if you have symptoms, are all very critical things to helping stop spread and helping stop spread and expansion within public environments, within workplace environments, or within our households too, for that matter. So the next slide, we have the start of an immunization program. The next slide, please. They have a number of products that are approved by Health Canada, and the approval process is designed around efficacy and safety. So how effective is a vaccine at doing what it's supposed to do, and how safe is it for our population? Health Canada doesn't skimp on the safety or the efficacy assessment aspects. So all these have gone through very robust testing prior to licensure, but also, as with every other product that Health Canada has its hands on, the post surveillance and the post approval surveillance is something that's super critical as well. So we have two general flavors of vaccine. We have an mRNA-based vaccine, so Pfizer, and then the Moderna products. And then we have these viral vector vaccines, this AstraZeneca or the Janssen product. Well, the end result of any of these vaccines is to raise and build the body's immune system. So you get your shot in the arm, your body builds an immunity towards what you've been given. And once it has that immunity, if it actually sees that same thing again, namely a fragment of the COVID-19 virus, it's prepared to be able to fight against it. And that's how our childhood immunizations work. That's how our influenza ones that we provide on an annual basis. And these are very, very similar. The effectiveness of these is very good. The mRNA-based vaccines after 2 doses have an effectiveness over 90%, which is very good. The AstraZeneca product itself, depending on how they measure the effectiveness, can be somewhere over 70%, which is very good. Some may have seen some of the messaging and the evaluations that have come out in the past several days to explore some of the safety aspects of the AstraZeneca product, specifically in the Alberta environment, ensuring that there is that risk benefit taken with it, and the further recommendations from our partners at Alberta Health that it be provided to those over 55 years of age. Our next slide. So we have a number of criteria around who has received the COVID vaccine product, or it's a COVID-19 vaccine. And really these come into a series of phases. Our phase 1 has been those at most risk of severe outcome. And the vaccine sequencing work hasn't been easy work. And again, that's our partners at Alberta Health who are really taking this on, and they've done some excellent work. The phase 1 was designed to protect those who were at most risk of severe outcomes, and that's those in long-term care and those that take care of them. And then critical infrastructure, primarily within hospital environments, namely our critical care, intensive care units, that if you have an outbreak amongst workers in those environments, well, that's generally bad for the entire healthcare infrastructure. Not a lot of backup in that aspect. So as of the end of March, we've had 620,000 doses administered, which is about 14,000 doses per 100,000 population, and there's almost 100,000 Albertans who are considered fully immunized, and that's pretty good. I think kudos to everyone to be able to do this, and it's product dependent. So as we get supply chain, we can deliver this. Our next slide. So that phase 1 was a December to January time period. So residents in long-term care, seniors over 75, First Nations, Métis, and Inuit within community settings. Our phase 2A were staff and residents of supportive living, our First Nations, Métis, and Inuit over the age of 50, and then seniors aged 65 to 74. A recent addition has been those with chronic conditions aged 18 to 64, the criteria of which is available on the Alberta Health website, residents and staff of congregate living, and then caregivers at high risk, and then some additions around other healthcare worker groups overall. So next slide. What does being vaccinated mean for me? It means that you're less likely to become sick with COVID-19. So it's very effective in terms of protecting against severe illness. Don't know yet if it really protects you from spreading illness if you are sick. So you might get exposed to it, but I don't know, because if you've been immunized, if you're going to have a reduced risk of transmitting it to others. Hence, if you are a contact, well, you still have to isolate. And certainly as the science evolves, that there may be some adjustments to that. But at this point, we're holding fast with our current recommendations around those that are defined as cases and context. Please do continue to follow those public health measures to keep unvaccinated people around you safe, and really to keep everyone around you safe. That personal protective equipment, isolation, and quarantine requirements are super important to be able to maintain good, healthy households, good, healthy workplaces overall. And the next slide. This is a really tough time for everyone. It's important, and we do have to remind ourselves of this, that we have to be kind to one another. And it's understandable that we've had a very uncertain last 12 months. And it's been, unprecedented times is perhaps part of it, but there's been so many changes. And when we looked at the decrease over that second phase, or that second peak that was our late February, early March, the protective measures we did collectively worked very well. And we need to hold on to this a little bit longer. As was said earlier in our discussion here today, we are in a race. We're in a race against the expansion of variants and other COVID-19 viruses throughout our population. And that's one part of the race. The other end of that is our emerging immunization program that is very protective. So we need to do our measures. We have to continue our measures, and we need to get our population immunized. So our last slide, we encourage everyone to get immunized when you're eligible. So have a good look at those eligibility criteria. It might be age-based, might be occupation-based, might be personal-based in terms of chronic medical conditions. Stay home, stay safe, wash your hands, wear a mask. Mandatory public measures, even after immunization, are super critical. And be kind to one another, check in on your loved ones, check each other's mental health. And hopefully everybody is able to monitor one another and stay safe and healthy. And that's all I had.
Thank you, Dr. Sakura. Ken Cobley.
Well, thanks, Mayor Young, for the invitation to come back. It obviously means that my presentation last time went okay. So again, thank you. Dr. Sakura, I have to tell you about the vaccination. One of the advantages of being an old guy is you are first in line to get the vaccine, and myself and my wife both got the vaccine as soon as we were eligible, and we had no concerns, absolutely none, because we want particularly for us to get back to some normalcy, and I think vaccines certainly is the key to that. Maybe, I guess, when we talk about where we're at right now, take a look at where we were and what we've done along the route. Certainly, this has been a really, really busy year for the Alberta Chambers of Commerce and definitely our member community chambers. Certainly the advocacy that we do at the Alberta Chambers of Commerce, we couldn't do without our community chambers like Leduc. We started back last year in March hosting weekly video conferences with our community chambers for a couple of reasons. At that point in time, the announcements from both the federal and the provincial governments were fast and furious. And we knew that chambers were the 411 call in the community when businesses were looking for information, but they're also the 911 call when things go sideways. So that is the reason why we started those. I can tell you we have an identical participation now of community chambers on our weekly call as we did last March. So that just tells you the commitment by our community chambers. A lot of the stuff that we do at the Alberta Chambers, as far as advocacy, to some degree is done behind the scenes. We don't stand up, I think, maybe as much as we should, and maybe as much as our community chambers should, and take credit for the advocacy that we do, particularly when our normal advocacy policies that we act on, we have about 80 policies in our books that would continue to actively advocate both the provincial and the federal governments. So in addition to that, over the last year, we've been advocating a lot on COVID. So we've been maintaining our normal policy book, and our community chambers have been as well. And add to that the task of bring constructive suggestions to the government of Alberta and the government of Canada on how they can improve programs. If we go back through the programs that have been enacted in the past year, you can see a trend as to changes that we should take credit, I guess, would hope that we have contributed to those changes. For example, the wage subsidy. By my count, I think the wage subsidy program has been amended about 3 or 4 times in the last since it was introduced. And that was, for a number of reasons. Government recognized that the original one, they started out at 10%, simply wasn't enough. So they moved to 75%. Then they recognized that, this thing wasn't going to be over by June. So it was extended to December 2020. Now it's extended to June 2021. So those are all good things. And I think it's critical for governments to continue to support businesses, especially all businesses, but especially those support businesses that are most hard hit, and need to recognize that those supports may need to go on for quite some time. CEBA, the loan program, was expanded from $40,000 to $60,000. The rent subsidy, which originally started out as a rent moratorium, was converted to actual dollar subsidies, and then again also the extensions. As with, and not to be critical of government, because obviously everybody was drinking from a fire hose to get support out to businesses as fast as they could, there were things that were overlooked. And in the beginning, with a lot of those programs, there were people who were falling through the cracks. People who were brand new startups that didn't have comparator numbers to the preceding year to actually indicate how much their revenues had dropped. There were some that were sole proprietors. There were folks who were taking their remuneration through T5s rather than T4s. They were precluded. My point is, when we heard of those pinch points coming from the community chambers, we were able to go forward to the government of Alberta and the government of Canada saying, look, this is something you need to address. Certainly, we've been advocating for government and we advocated to government to clarify and set targets for reopening. And I have to put the proviso on here, safe reopenings, okay? We are not an organization that's advocating for let's open her up and let her rip. Definitely not. We recognize that we need to protect the health of all Albertans. And to be honest, we need to protect the health of our businesses. There is nobody that cares more about the health of Albertans than it is people who are running the small businesses, who are protecting their patrons and protecting their employees. Certainly that's top of mind. The suggestion we've made to government government of Alberta is that their focus on their website, when you looked at the staged reopening, step 1, step 2, step 3, step 4, the only thing that was on the website was the number of hospitalizations. Speaking as somebody who has, and please don't judge me on this comment, speaking as somebody who has watched all 197 live briefings of the Chief Medical Officer of Health for the last year, I understand that it's more than hospitalizations. It's about the leading indicators. It's about the infection rates. It's about the R factor. It's about the variants. However, the government of Alberta perhaps needs to change their website to make that very apparent. Because right now, when businesses go in and take a look at it, and it's changed in the last couple of days, all they see is they see the hospitalizations. It needs to stand out more that there are other leading factors that are affecting it. Unfortunately, government or businesses, when they go in and they have seen a target set of hospitalizations by itself, then that creates a fair bit of concern, a little bit of angst, maybe a little bit of anxiety when government isn't proceeding based on the hospitalization numbers. Things like reopening, and Shadi and I have had a couple excellent conversations over the last 3 weeks. We had excellent conversations with her back about 4 years ago when she helped out the Alberta Chambers of Commerce with our Vote Prosperity platform. And certainly reopening of personal services businesses, we had a hand in explaining the logic to government and Alberta Health as to why personal service businesses should be opening. We're right now taking on the task of also looking at other sectors and individual businesses who have a very good case to be put forward to government to seek an exemption on reopening. We had success, and we were able to get to someone within Alberta Health who we were able to connect the dots between Alberta Health and the business, where they could make their case for a specific exemption based on the protocols and the safety measures that they had in place. So we've had one success so far, one business at a time. We're working on it because I think everybody benefits when we have some logic to the exemption process. The concern that folks were having, businesses, individual businesses, is how do I get to make my case to business? And we're endeavoring to help them do that. Like I say, we've had one success, and that's not bad since we started on this journey about 2.5 weeks ago. We've been helping, obviously, when you get the overwhelming responses to government applications for the Relaunch Grant. And Brad, I'm glad that your office is taking that on as well, or has taken that on. But again, chambers tend to be the 411 call. How come my SMERG grant is held in review? Again, we were able to find somebody within that particular department. And when I hear comments or I hear cases from our community chambers on our weekly call, I'm able to connect into government and say, look, here's one that's been sitting there for 3 months. Is there an issue with it? Like, can we get some clarification? And a lot of cases we find that it's things like their corporate name doesn't match up identically to their application. Well, that's an easy fix. And we're able, and I think they appreciate it in government, that we're able to actually clear some of those backlogs because I know that they are working very hard to do that. Again, I mentioned, assisting individual businesses to reopen. And Shadia, expect a phone call from me, another one. I'll just, and maybe, Mary Young, if I have a few minutes, just to talk about some of the other things that we're working on. Because again, remember that the effect on this is not only by COVID, it's also about the issues that we're facing as a province. And that is contributing to, the dire straits that some of our businesses are facing. Obviously, of a big concern, and what we've been advocating on is the replacement for Line 5. That appears to be hitting some snags with the mayor of Michigan. So we've been active with our colleagues in Ontario Chamber, particularly the folks in Sarnia, because they're going to be directly impacted if that Line 5 process doesn't go forward. Obviously, top of mind for everybody is Keystone XL and what's happening down there. So we continue to be very active on advocating on that. We, over the last 3 years, we've been also developing a business apprenticeship program and work integrated learning program. And what that is it's trying to connect the dots between post-secondary graduates and businesses who are actually seeking employees. Believe it or not, in this province, with a 9.9% unemployment rate, we are still, in our latest Alberta Prospectus survey, finding that 15% of businesses are finding it very difficult to find the skills that they need to hire. And 36%, they're finding it somewhat difficult. So that's a great mismatch to me. And I think what we're in fact be trying to do is we're trying to be that conduit from somebody coming out of a post-secondary to getting a job somewhere in Alberta. And we're uniquely a place for that because we have community chambers right around the province. We have 120 of them, a lot of them located in rural locations outside of Edmonton and Calgary. And if we can connect the dots and get folks back into employment and help out employers, bonus points. One of the other things that we've been successful on within the last six weeks is AltaLink applied for a rate reduction. AltaLink, the transmission folks for electricity, applied for a rate reduction, and we supported AltaLink on that application before the AUC. That resulted in a $223 million rebate to businesses and individuals because the AUC moved that along. We are currently looking at assisting the government of Alberta Health, with the rollout of rapid tests from the government of Alberta to small and medium-sized enterprises around Alberta. We had a great conversation this morning with some folks from the Emergency Operations Center and communicated that information off to the community chambers. So any way we could help government to help small businesses, we're all over that. Our latest survey on municipal red tape reduction and cooperation with business community, that's imperative. And I know I'm preaching to the choir in Leduc, because you guys obviously have a great track record in working with your community chamber. But what we need to do is we perhaps need to bottle that relationship up and sell it off to the rest of Alberta. And we're doing a lot of this research and a lot of the information with what we call Alberta Prospectus. It's a revolutionary survey platform that we can provide back information on survey results to community chambers by postal code. So they can tell what the mood is, what businesses in their community are saying. And we think that's going to be a very valuable tool going forward. The other thing, and I'm wrapping it up here pretty quickly. Vote Prosperity, before the last provincial election, we issued a non-partisan platform by the Alberta Chambers in an endeavor to try to keep the discussion during the provincial election to issues and not personalities. Our community chambers will obviously be gearing up for the municipal elections with a Vote Prosperity similar type of rollout. And again, trying to keep it based on local issues and not on personalities, because that's critical to advocacy and also improving our communities. There is something coming down the pipe very quickly, that hopefully very quickly, that we've been dealing with the government of Canada on now for close to 4 months. And that's why I say hopefully very quickly, 5 months, is we will be announcing shortly a major shop local program that will be delivered out via the community chambers in municipalities around Alberta. So that one, fingers crossed, should be announced shortly. A lot of these things that I talked about on advocacy, on success, would not have been possible without our community chamber support, because they also do direct advocacy into government. Obviously, Brad, you've had several phone calls from your community chambers in your riding, and that's actually where it's not just me giving them anecdotal stories. It's also the community chambers involved in every point of advocacy that we do in the province of Alberta. So with that, I'll wrap it up. Thanks, Mayor Young, for your indulgence on letting me ramble on.
Thanks, Ken. And, our council, it's a priority with us to make it as easy as possible to operate and own a small business in the city of Leduc. And we take that very seriously. I think the pandemic has really put more emphasis on that. So Melissa, take it away.
Well, I don't think I'm going to be a very good politician, because we're going to make this quick.
Well, that's
So
good.
I'm Melissa Lanos with King Business Solutions. It's a bookkeeping firm here in Leduc. We've been here going on 12 years. We're now in the downtown, so I do have a position on the Downtown Business Association board. At King Business Solutions, we take care of clients and businesses to understand their books, their income, and their cash flows. With the subsidies, we are helping work through those questions and filings, and we're here to listen, as this has been a hard time. And I feel like I maybe should have done more in mental health in my education, because I feel like that's what I do most of my days now. Just being here for our clients and anyone that's calling. With the DBA, which is that Downtown Business Association I mentioned, we are here to listen to the businesses. We have a full-time employee that is there going and knocking on the doors of the businesses and is available for calls and questions from those businesses. We try to get them answers. We're doing as much advocacy as we can and working with the chamber on some of that here in Leduc. We also working on some community events that we can and are allowed to do with the current restrictions. So if you can add yourself to the Facebook page, if you haven't already, that'll give you some different things that are around and available in Leduc and the downtown area to get people out and about and on the streets and shopping local, as Ken was just saying. So that's it for me, because I think that questions are probably going to be lots. So the Downtown Business Association is here for everyone, and as a bookkeeper and always been Alberta or Leduc resident, I'm here for any questions or comments that you have.
Thanks, Melissa. I'll also mention at this time that Jody Kessler here is from TELUS, and that we were very happy to announce last week that TELUS is bringing their Pure Fiber program to our downtown and to our North Business Park. And so if there are any questions, she'll be able to answer questions on what is a really good news story for the city of Leduc. Thanks, Jody. And I'm sure there'll be some questions.
Yeah, no,
So
thank
Natalie,
you for having me.
Oh, it's great news for the city of Leduc. Natalie, you have some questions for us.
We do have questions. So first one came in advance, and it's for Dr. Sakura. They're asking, given the info I've seen on potential adverse effects of the vaccines, where can we access the science that proves their efficacy so we can refute the claims of the adverse events? And then also, is there a reporting site to access the number and type of adverse reactions in Alberta?
So that's a great question. And of course, when we look at the expected adverse events and effects that are related to immunizations, we typically cluster those into some broad categories, one being local effects and then more systemic effects. When we look at something like a product monograph of any of the immunization products, we always see what those expected side effects are going to be. And for some of the mRNA products, we expect probably about 2 to 3 out of every 10 individuals are going to have pain and soreness at the site of injection, sometimes worse after the second dose. There's also going to be a significant proportion that would have general tiredness and fatigue after immunization. And that's, that's the immune system sort of kicking into high gear and starting to turn out good antibodies and future protection. What we have here in Alberta, much like every one of our provinces, is an adverse event monitoring system. So whenever an immunization is given, it's given by somebody who's qualified, somebody who is very skilled in not just making sure where it goes where it's supposed to go, but making sure that you as a patient and ourselves as patients are healthy and are well aware of what those common side effects might be. So they will chat with every patient about if they are healthy, if there are any contraindications to an immunization. And they always have people wait for that 15 minutes after to make sure that one of our most feared adverse events, or anaphylaxis or a very severe allergic reaction, if it does happen, we're there to really save an individual. And, that happens probably 1 to 2 times per million. And I believe our Chief Medical Officer of Health has indicated some of these adverse event activities in some of her daily or frequent briefings. And I also believe that Alberta Health has some of this information available online, or at least on their website. Ultimately, there are risks and benefits to every immunization, and we always try to balance those risks. From true contraindications, what is being identified at this point in time is the main contraindication being the previous allergy to one of those products within the immunization itself. That's relatively uncommon. And that's always balanced against that benefit. And the benefit being that those who have completed 2 doses of the vaccine series will have a protection against severe illness anywhere between 70 and 95%. So that's the benefit, both as an individual, but also as a household, as a business, and also as a society overall, as we get more and more fractions of our population protected. Now, what we also have in Canada is really partnership between all of our provinces to monitor both nationally here in Canada, but also internationally with our partners in Europe and the United States and everywhere else, to be able to monitor long-term what some of those side effects are. And you'll have seen the outcome of that with the adjustments to the vaccine product to refine it to over 55 as a result of an observation of a side effect that was unexpected, and that's blood clots in individuals at a rate of somewhere between 1 in 100,000 to about 1 in a million. And that's only because we've been able to worldwide provide tens of millions of doses to be able to categorize that. So there is a very robust adverse event monitoring system in place. It's something that we take very seriously, and it helps refine what our advice is to the public and the population overall.
Well, can I just jump in?
Yep, definitely.
I just want to make sure that, just to follow up on those comments, on the alberta.ca website under the vaccination program, you can learn about the vaccines. It'll take you to another link that breaks down what's been approved and some other related information around safety. And that'll take you also to Health Canada for additional information that you can review on your own as well. So I just thought I'd mention that.
Thanks, Brad. And I just want to say, I was vaccinated just over 2 weeks ago, went online. It was a very quick process to book my vaccine. Went to the Leduc Public Health Center here in Leduc, and it's a very well-run operation. I don't think it took me 20 minutes total. And the nurses there did an excellent job, and really impressed with the way our vaccine is rolling out. So I can't say enough about that. And we know that as things roll out and as we get through to June, that hopefully the pandemic will be behind us. Natalie, another question.
Yeah, so next question we have came in for Shadia, and they're asking, what would you say to other businesses who feel like they're in the same or a similar position as you? Who or how are you reaching out to organizations to see what you can do to reopen in a safe way?
Oh, you have to unmute, Shadia.
There we go. First of all, I've been connecting with other business owners in the community. We have so many incredible small businesses. So I've been connecting with owners. Just that communication helps to just feel the support that way has been incredible. Also, of course, our local chamber office, that team is absolutely incredible. They always give me their time. They listen, they understand, and they offer support in any way that they possibly can. So please reach out to them. And of course, our MLA, Mr. Brad Rutherford, has been fantastic. He's taken my calls, my emails, and my staff. I have a few staff members that are working in other industries, and some of them still have those jobs now. And they're sharing with me their experiences, what are some of the shortfalls that have happened, what are the positives, what are the negatives, and how they can learn from particular situations that have arisen. And we've been able to take some good advice. I've been able to take some good advice from them. They've been fantastic in that way. And then I've been very fortunate because my industry has a wonderful association. So there's the Motion Picture Theatre Association of Alberta, and then there's also the Motion Picture Association of Canada. So I sit on both boards. I'm the president of the Alberta board. There's 86 movie theaters in Alberta alone and 38 independent theater owners or independent theaters, aside from the big chains, but I'm always in connection with them. On a weekly basis, I send out emails to them. We're always connecting, whether by phone. So I'm very fortunate to have that industry support. But again, like I said, connect with other business owners, connect with your local chamber, connect with our MLA. And of course, I'm sure our Mayor Bob Young be happy to hear from you too as well. So those are the measures that I've taken to get the support that I need.
Thanks, Shadia. Natalie, do you have another question?
Yeah, so a question for Jody about the TELUS build. They're asking, is the speed increase with the pure fiber build only when you're plugged in, or will individual Wi-Fi service also be better?
As a general rule, you will get an improved Wi-Fi service. I do have to add with the caveat that Wi-Fi is a wireless service. So we have to sometimes work with the disturbers within the building we're serving. But we have methods to kind of work around that and work with those things. But as a general rule, your Wi-Fi will be a faster, more stable level of service as well.
Thanks. Next question, Natalie.
Yeah, so next question is for MLA Rutherford. They're asking, can stage 3 businesses make a case to be considered or moved to stage 2 to allow them to reopen? Is there an exemption process that can be explored?
There is an exemption process through BizConnect or directly through Health, where you can present a plan for your business or for a sector to try to either have restrictions eased or restrictions generally potentially lifted. And now I know, because this touches on some of Shadia's comments as well, that the Motion Picture Theater Association has put forward plans about how a reopening, what it would look like and how it can be safely done. But that's helpful for me to hear, because we've had many conversations about this, and then she has also sent me the literature that I can read over so that I can advocate for that to the government. If there's examples of that, don't hesitate to reach out and to make sure that I can hear from you. We can go back and forth on what the plans are or why you feel like things should be shifted around. I think the government has been receptive to hearing advice on why things should be potentially changed, and has made some consideration to that. And I can't guarantee you anything. I'm not in cabinet, so I don't have the final decision on these things, but I can certainly try to make sure that your voice is heard and that your case is made directly to the government as well. So that's what I would suggest on that.
Thanks, Brad. Natalie, next question.
Yeah, so we have a question for Ken Cobley. They're asking if we have a concern that we wanted the Alberta Chambers of Commerce to advocate for, what would be the process to get that started?
The best way to do that is talk to your local chamber, because the way policy is developed at the Alberta Chambers, and it's not just me picking ideas out of my head to advocate for. Our policy is structured such that a policy is brought forward by a community chamber. Okay, so they would, within their own chamber, they have a policy committee that they would evaluate and see if that's something they want to bring forward to the Alberta Chambers to advocate on. And then the policy goes to our AGM. If it's adopted by the majority of chambers, then it becomes a policy that we can advocate on. If we don't have a policy on something, I can't advocate on it on behalf of community chambers. It's a structure very similar to what AUMA, Alberta Urban Municipalities, does. So I guess the key point is talk to your community chamber. They be careful though, because if you bring an issue up to them, they just may grab you and put you on the policy committee.
Okay, Natalie.
Sorry,
Next
Mayor.
question.
Can I just speak to that? We do have.
Oh yeah, definitely.
Yeah, so we do have a policy committee at our local chamber. It doesn't cost you anything. So if you do have an issue, please come to our chamber and meet with us, and we will definitely look at it. We've also written letters to our MLA, to Brad Rutherford, and also to our MP, Mike Lake. So if there is an issue, we can advocate on your behalf. And yeah, that's what we're here for. So please come see us, and it doesn't cost you anything to do that.
Thanks, Jen. Go ahead, Natalie.
Yeah, so we have a question, I think, for you, Mayor. It's about the 65th Ave interchange. They're saying it's my understanding that the city has already spent over $10 million in the last few years related to the project and has committed an additional $12 million to finalize the project. They're wondering whether that's correct. Is it correct? Will the city be contributing any additional dollars if funding doesn't come through? And what value does the city see the overpass bringing to local businesses in the city of Leduc?
This is one of my favorite questions to talk about. For over 20 years, Leduc City Council has been trying to get 65th Avenue overpass built. And to finally get support from the Alberta government, it's great news for the city of Leduc. So to clear up the finances, so we put money in for the original planning so that we could get the planning. So we knew that if we didn't start the planning, at least it wouldn't go. And so I believe it was around 1.2, 1.5, somewhere around there, $1 million. And we did a partnership with the province as well. We also knew that we were going to have to put money into this. Our total contribution to the overpass, it's about an $85 million project, and the city of Leduc is going to put a total of $12 million in, 12.5, somewhere around there. I don't have the exact numbers with me, but it'll be around that. The city of Leduc will put in about $12.5 million. The province of Alberta has committed to put in $33.5 million. And what we've done is we know that the federal government is committed infrastructure or more funding through the national or Northern Trade Corridor funding program. And so what happened is the premier actually put in an application to the federal government looking to get $50 million from the federal government. And we still haven't heard back from that. But when we were talking with the Minister McIver, he knows how important this project is to our region. And so he basically said that if in some chance that the federal government doesn't come through, that the Alberta government would still find a way to finance this project. The benefit to this area is that we just passed last week the 65th Avenue Business Park area structure plan. It's just in our northern business district in Leduc, bordering the airport. It's going to be hundreds of millions of dollars in investment. It's going to be thousands of jobs once this project is finally completed. And that's just within Leduc. It will also help the airport. It will also help our Leduc Business Park, and it will also help Nisku Business Park as well. And the benefits to the city of Leduc, so this brings jobs into our community. This brings people into our community. People are going to be buying houses. That means that small businesses, the way they'll benefit is that when we have more people in our community, there's more people that are going to be buying gas. There's going to be more people going to restaurants. This is just it's a multiplier effect. And so this is when this project is completed, it's going to be a huge benefit to the whole region. And so I have to give kudos to MLA Rutherford. We worked long and hard on this one. And, I think MLA Rutherford was really played a crucial part in helping to get the funding from the provincial government. So, it's going to be a very big project for the city of Leduc and for our region. Next question.
Yeah, well, you touched on all the high points there. But I just want to say that your mayor is very easy to work with, and we advocated quite hard because there was no provincial funding for this before our government formed in April. So this really is something that needed to get funding allocated to it. That's happened. But I'm also aware that until you start seeing an interchange actually being built, that you're not going to be satisfied, and neither am I. So we're going to continue to be after Alberta Transportation to make sure that this is a priority. It's got the funding, and now we need to get to just that little step, construction.
Yeah. Well, and when we met with Minister McIver, that's one thing he did say, is that we would have pilings in the ground by September. So we'll be holding him to that. And again, we would have liked to have seen the construction start earlier this spring, but you know what? We've been waiting for over 20 years. We know the project's going to take 3 years to complete. So if we get started a couple of months late, it's not a big deal. We just, once we get it started, that'll be the big signal that it's going to get done. Natalie?
Yeah, so we have another question for Dr. Sakura. They're asking, what is your prognosis on the COVID variants, and do you feel there's a possibility that it could result in more closures?
Oh, good question.
Oh, this is a crystal ball type question.
I hope your crystal ball's working better than mine, Dr. Sakura, because if I was a big league hitter with the batting average I got on that now, I don't think I'd make a nickel.
I think we all share a great deal of worry and concern around the expansion of the COVID-19 variants themselves. More easily transmitted, more severe. And when we see that tail end of that peak starting to trend upwards, we are getting concerned. I mean, 300 hospitalizations at this point in time, and it's a concern. The precautions, I think what it leads into is that staying at a phase 2 at this point in time is a very correct action. Maintaining collectively all of our efforts around physical distancing, the hand washing, the wearing of masks, anything we can do to help reduce probability of transmission is a good thing. Staying home when you're sick, it's still really, really important, as is getting access to testing if you have any symptoms at all. So those are all very core key things that all of us collectively have to do to help limit the spread of something that is more easily transmissible. Whether or not there'll be further restrictions, I couldn't hazard a guess. I couldn't hazard a guess, but I think collectively all of us have a great deal of concern around the variants themselves.
Is it fair to say, Dr. Sakura, that the next 2 weeks are really going to tell the tale? Like, we've seen the hospitalizations gradually go up, where they were going down before. But as long as we don't see sort of the hospitalizations that we saw earlier in the pandemic, I'm the optimist. But that's to me, next 2 weeks.
I think we're coming up on, well, for those of us with kids, we have spring break. We have it's Easter season. These are historically times when we have more time with family, more time together. And I think collectively as a society, we have to be vigilant and maintain our physical distance. And have the Zoom Easter dinner. And I think that's the very appropriate thing at this point in time still. And I guess we'll watch what those hospitalizations look like, what those numbers look like. And if those numbers are going up, that's not good. If the numbers stay the same and start to either plateau or go down, that's a better position for us as a society to be in, absolutely, because that means that we're getting a hold on what transmission events are. But those indicators in the past couple of weeks are not particularly positive. Our value is indicating that we're seeing an increase over time in most jurisdictions across Alberta. So we, as a group of Albertans, do have to remain ever vigilant and ensure we have all those precautions in our work, in our home, and in our other lives.
Can I
Go ahead, Brad.
I just want to remind everybody as I touch my face. Sorry, doctor. It's a habit I continue to forget. It was Thanksgiving and Halloween that sort of were the precursors to a large increase in cases back in the fall. And I know that the stress level and the fatigue level on this is high. That is very apparent when people phone in, regardless of their opinion on restrictions. It is at a max. But the end, I believe that the end is in sight as our vaccination rollout is happening. And from the presentation the doctor had, it's clearly shown for designated supported living and long-term care, there is a dramatic drop in cases when people are fully vaccinated. So it shows that it works and that we are getting to the point where people are going to have that option on the vaccine as well. But to give you on a daily case number, I believe, and I might be slightly off on this, it takes about 7 to 10 days for the hospitalization numbers to begin to go up from a daily case number today. So it's sort of, that's the initial indicator, your case numbers followed by your hospitalization ICU. Your average age in hospital is 59, your average stay is 14 days. So when the hospital begins to fill up, it takes a long time to begin to get that under control as well. So as the doctor said, vigilance is important now, and especially with the end in sight. Hopefully some better weather, obviously, where we can gather outdoors and do so in a safer manner.
Yeah. Thanks, Brad. Natalie, next question.
So another one for Ken Cobley. They're asking, are there sectors of business that you believe you're seeing growth and sustainability? And on the flip side, what sectors of business are you most concerned for at this time? And then regarding the sectors that you're concerned about, how has the Alberta Chambers of Commerce supported these businesses?
Sure. Thanks for the question. I think there are some bright shoots in our business environment at this point in time. Things like the ag sector, by all accounts, we've had a really good year this year for agriculture, and that's good news for Alberta. I think one of the things that we need definitely to look at is diversification of that sector and getting more of a product off to buyers offshore. Tech businesses seem to be moving along, perhaps due to the stimulus that the government introduced. Motion picture sector is really moving along as well. It's one of the best years that we've had in history for that sector, and it's also a good diversification. We went into this whole thing with our economy already somewhat weakened. It wasn't just COVID-19. It's been the 4 or 5 years that we've had with low oil prices. And, I guess if we see the prices of late, and that they're so volatile, but if we see the prices of late, Western Canadian Select is strengthening against Western WTI. So that's good news. And the price of oil is increasing as well. So I think that will help out a lot of sectors that are truly dependent on oil and gas and were hurting before COVID came along. Second part of the question, what sectors am I most concerned about? To be honest, I'm concerned about all sectors at this point in time, because with the rising case numbers, the situations that we have for business at this point in time are very tenuous, to be not overstating that comment too much. So all businesses are at risk if people don't take personal responsibility for their actions. It's all up to us. Businesses trying to protect their patrons and their employees. It's all up to us to protect the business and allow them to stay open. The sectors, if you were to pick some sectors that I'm really concerned about, it's obviously those businesses that haven't been able to open till step 3 and step 4, because step 3 still looks like it's a ways down the road. If you're looking for specifics within that area, tourism, hospitality, hotels and lodging, all very hard hit. And again, not just because of COVID. What we're doing to assist or advocate on behalf of those particularly hard hit sectors is wherever possible. We are supportive of the mess. A lot of those businesses are represented by industry associations. For example, tourism has its industry, hospitality, the Lodging Association, the Hospitality Association. So wherever possible at the Alberta Chambers of Commerce, we're echoing what they're saying. We're trying to support their messaging where we can. And we feel that if that messaging is coming from more than one particular source, it becomes stronger. And with the Alberta Chambers of Commerce, we have the sort of luxury of having a very diverse membership. So if we're supporting those particular businesses, it doesn't appear that we're only worried about one of those three businesses. Again, I hate to be a real downer on this one, but I am concerned about all businesses at this point in time. One of the businesses, and you know, a very valuable business in this region, obviously I don't have to tell anybody that, is the airport. And the amount of the issues that we're facing there are tremendous. Purchaser of supplies, a tremendous employer. And at this point in time, with their numbers down, that is certainly having a tremendous effect on the airport and as well the economy in the Leduc-Nisku area.
Next question. Go ahead, Natalie.
Yeah, so another question for Jody. They're asking if the connection cost for the Pure Fiber build is being absorbed by TELUS. What is the subscription cost compared to current business plans?
Plan pricing won't change with the conversion to fiber. I felt like that was too short of a response, but that is the long and the short of it. It does remain the same. So everything can be found on telus.com as well for more specific plan related pricing. But from copper to fiber, there isn't an additional charge.
Good to know. Next question, Natalie.
Yeah, so one for MLA Rutherford. Does the province have any plans or options in place to support businesses that have had to close or are on the verge of closing with regards to the legalities of ending their leases prematurely?
The current business benefit or the enhanced business benefit coming up in a few weeks, I think can be used for offsetting rent costs, but specifically to leases, that hasn't been stipulated as a separate funding stream. But it is certainly something that can be brought up it would fall under Minister Schweitzer's ministry on support. And if you can reach out to our office with a specific example of what your situation is, how it's affecting you, what those costs are. I'll be happy to help get some better answers on that.
Okay, Natalie, next question.
Yeah, so this one, it doesn't say that it's directed to anyone in particular, but they're asking, is there any conversation for significant discrepancy regarding outdoor venue capacity? They say it's unreasonable to implement a quantifiable standard of inclusive capacity to each motor racing facility, as historically motorsport has not been classified under any part of racing ordinances. Alberta exclusively referenced results for horse racing and casinos. They're asking for clarity on current racing entertainment center capacity guidance versus capacity aligned with existing AHS guidance and protocols for restaurants, bars, personal service, golf, or outdoor recreation.
Okay, so it'll be either Dr. Sakura or Brad question.
Yeah, I'll start it off. Like in terms of theater seating or stadium seating, I don't think that the government is going to consider that until step 4. I'm not sure, barring putting together a separate plan and submitting it through BizConnect to ask for an exemption. I think it's going to remain in step 4. And it'll probably be a combination of what the plan looks like, what the weather is like, and where the vaccinations are at as well. I think when they consider some of these things, they try to consider who's going to attend, how close are they going to be together, how often are people going to move around, and what are the interactions going to be like, as opposed to them sort of imagining a situation in which there's sort of more stability in where groups are in a certain business. and having some control over that. If they think that it is going to be large congregations of people moving around, they're more hesitant towards that. But of course, the same offer, and I believe we have spoken before that presenting the right plan with some of the considerations I think they're going to bring to it can help get things done a little bit sooner.
Okay, Dr. Sakura, did you have anything to add?
You know, I think that's a great response. And there very well might be some gaps in some of those guidance documents on the BizConnect. Where there are gaps, I think it's important to highlight where they are, and that steps should be taken to help address them. So being able to escalate and raise those questions through the appropriate forums and through available forums is certainly allowable and encouraged, and really allows those individuals in our Alberta health environment to be able to consider and, if necessary and appropriate, adjust.
So I had a text too that's sort of along this lines too. It's so minor sports, outdoor sports like baseball, soccer, and all that. So, I mean, they're starting to get underway now, and they're allowed to. Do you think that this is going to be a tough question, I think, to answer? But what do you think the chances are that they'll be able to play their outdoor leagues like they normally would? Like, I know, like last year, baseball, they had a modified sort of the way they did it, but what does it look like for minor outdoor sports right now?
I think it's probably more possible, or it's probably a poor way to structure a sentence. It is likely to happen as the weather gets better and that the pressure grows on that. When these leagues start to pick up and they're starting to figure out, okay, how many people can we put in a ball diamond or on a soccer field, and keep them either distance or within the specific cohorts. Youth sports important. I have lots of parents who phone in talking about what their kids are missing out on, and their need to get out and interact and exercise. So that's not lost on me or the government, in that it's an important consideration, because it's one of those restrictions where I think there is a very high adverse effect on the other side as well. And a lot of the parents say, frankly, these kids are all in class together, and then they can't go out and play baseball together, for instance. And there's valid points like that are very fair to make. And again, like, it's one of the couple things that I noted down that I've gone to the government on youth sport, especially for outdoors. Along with things like single family cohorts. I've talked about that since December. Having at least one other family you can rely on, I think would be helpful as well. So these are some of the things that I push for, to make sure that we can have, because it's going to be important.
Dr. Sakura?
And certainly collecting what those comments and concerns are and putting them forward, I think, is definitely a very, very appropriate thing to do. And just looking, it looks as if youth sport, at least easing of restrictions, might be in the phase 3, but really the devil's always in the details on what the phase 3 and the phase 4 relaunch are.
Yeah. So I guess what you would both suggest, though, is to make sure that parents and coaches and that they advocate for their teams, and if they can come up with safe protocols like that, that's the best thing, is to run those through and see if they can get approval for it. Is that fair to say?
I think some of it's those associations coming together and putting forward a plan, either something that they had, the guidelines they had previously, and maybe they're worked on a little bit. But just to give you an impression, I mean, the variants are increasing. And if you look at just the variant number, it's increasing quite quickly, almost exponentially. Yeah. And so I don't think you're going to see in the next few weeks any significant decisions on restrictions in terms of broad sectors. And there might be things that are more specific, but again, that's up to cabinet, and I'm not in that room. So it's important for those associations to have a workable plan that they can present if they're looking to be exempt, or something they can implement if the government decides that a restriction can be lifted on a certain sport.
Yeah. So what we'll really be telling in the next 2 to 3 weeks is the numbers. Like, it's like it all basically comes down to what our hospitalization rates are, and I'm really hoping that they plateau and start to drop, but that's really going to determine when we move into the next phases. So, anyways, Natalie, next question.
Yeah, so we have another question for AHS for Dr. Sakura. There are actually a couple of questions kind of along the same line. So they're wondering what are current recommendations regarding the deep cleaning or sanitization of a business space? Where can we go to find out what the standards of cleanliness are for a particular type of business? And what kind of advice can you provide to businesses in terms of cleaning processes as they go through the stages of reopening?
Oh, certainly, and thank you very much. In terms of specific guidance for sectors or for industries, we always are referring to our Alberta Health, Alberta.ca under BizConnect around those relaunch guidance components. There's some excellent resources, and a very specific one with links I put into the chat box around general relaunch guidance, which has the specifics of what is a high touch surface, how often you should clean them, what kind of products you should be using. The hint being it should have a DIN number from Health Canada saying it's approved for use on COVID-19 itself. There's an easier, by easier I mean shorter, less words in the document from Alberta Health Services around our population public health, environmental cleaning for public facilities document that certainly is very helpful around what products can and should be used to help provide for those safe spaces for our public and for our workers.
Okay, next question, Natalie.
Yeah, we have another one for MLA Rutherford. It's from our councillor Finstad. He's saying he is hearing numerous stories of businesses that have been forced to close and can no longer continue. Some have walked out on their lease commitments with the threat that the landlord will pursue under the personal guarantees. The business owners have lost their livelihoods and face the real prospect of losing their homes, all through no fault of their own. What can be done to help alleviate the devastation that will occur?
Well, it's a very fair question because that is a reality for some business owners. But again, that would have to go back to Minister Schweitzer. It's sort of covered off from a few questions ago on covering off of leases and then what's available to landlords or to the business owner. Frankly, it's for some of these business owners, quite a few of them, obviously. There are factors beyond the government's control, and then there are factors within it. The price of oil, the global recession, but the restrictions that the government put in, I've always felt that they either help businesses get through it or they give them a chance to operate and generate revenue. Like those are really the two options that you have. And anytime these programs are falling short or people are unable to apply, we've come across different situations, frankly, where the business owners just couldn't simply access it, just even the way their business was incorporated or registered. There are gaps that need to be filled, and we just need to be made aware of those gaps. And so this is another one of those situations where please let me know, or you can go through the chamber or both. Frankly, the more avenues, the better. Where the gaps are, and then we can go to the government and make sure that is being heard. And I would encourage anybody on this call and through the chambers as well, as you take questions and concerns coming in, the same thing. I need to know where those gaps are, and then make sure that the government is aware of them as well.
Okay, Natalie.
Yeah, we have another one for you, MLA Rutherford. Are there plans to have the eventual easing of the province's work from home mandatory order coincide with employees being eligible to receive the vaccine? And then another question kind of along the same vein, is there any update on the vaccine rollout regarding how to get an exemption to allow employees from certain sectors to be vaccinated more quickly, like service workers or frontline staff, that kind of thing?
So I don't believe that the work from home order is going to be lifted sooner. Frankly, I think it's going to remain in step 4, and it'll probably stay there. In terms terms of somebody getting a vaccination, Dr. Sakura will be able to obviously, I think, provide a bit more insight into this, but it takes about 2 to 3 weeks to get to the immunity that it offers. So there is that delay, and I believe that there are it's still a potential for somebody to be able to spread the virus of SARS-CoV-2, even though they're immune themselves. I don't think the data is fully collected on that. So I don't think they're looking for that order to be lifted based on just I received that dose. I think there's still a period of time they want to see to make sure it's taken full effect, and then have a wide enough immunity amongst the general population before they begin to do those kinds of things. Can you remind me of the second part, Natalie?
Yeah, so there was about the exemption piece, and then it was, hold on, I lost it. Oh yeah, the easing of the work from home mandatory order, and then is there an update on the vaccine rollout about how to get an exemption to allow employees from certain sectors to be vaccinated more quickly? Okay, sorry. On the second part, we have brought those kind of concerns forward to the government as to who should fit where. The response has been consistent in that they just don't have enough supply. And so what they will say back to me is, if one person gets it, which other person do you not want to have it that's currently listed in those phases? And I think it's a fair response. They're trying to get through the more vulnerable populations in age and in health conditions as we get into phase 2B. But I'm not shy about taking in criticism or suggestions on where people should fit and things that can be considered, and very aware as well that I can't imagine what everybody else's job is like. So I can read through the list and maybe I'm missing something myself. So if there's a concern as to where somebody falls on that list, and a certain aspect of their job's not being recognized, let me know. I've only had a few jobs in my career, from washing dishes to law enforcement to this. So clearly have not done everything that other people have done. So don't hesitate to explain to me why it missed the mark and what the government should consider.
And I think Brad makes a good point that if you're not unsure about something, reach out. Like should be reaching out even to the city of Leduc, because we do have regular meetings with Alberta Health Services, and we do have connections to Alberta Health Services. And so, if there is something that you're really unsure of, it never hurts to ask the questions. And if we don't have an answer, we can certainly find somebody who does. And this wouldn't be the first time that we've reached out to Dr. Sakura or to some of the others. And, these are truly trying times that we're living through right now. And, the more we can do to help each other out, the better it is. Natalie, you have another question? Oh, sorry.
And MLA Rutherford did bring forward a really critical point. In an environment where we are very much dependent on supply chain and really, really dependent on bringing immunizations into the province, those decisions are very, very hard decisions. When one group obtains vaccine, that means somebody else or another group is not able to. So the discussions largely have turned towards, well, where is it going to do the most amount of good for business continuity, for maintenance of health or prevention of disease? And those are very, very challenging discussions to have. And certainly as we get into these later phases, or I guess mid phases of the vaccine program, they are very intense discussions. And thankfully, I'm not at those tables because, well, there's other groups that are making those decisions. So certainly being able to collect and describe what the concern is, why there is an importance for your particular group. I think what I've seen is that the committee that is making those recommendations are receptive to hearing those. But they're also hearing from many other groups and are trying to balance things in a way that's fair, equitable, sustainable, but also has the most amount of good from a societal viewpoint. Certainly the announcement in the past couple of days to really open phase 2B is speaks to underlying health conditions and those with underlying health conditions at being higher risk of having bad outcomes from COVID-19. And, you know, that makes sense. But that's all balanced against some industries and everything else. So it is a very difficult balance.
It is. Natalie?
Yeah, I think we might be down to our last question. And this is another one for MLA Rutherford, asking, are there any provincial mandates that will guide HR discussions for businesses regarding return to work and the vaccination rollout?
Not that I am currently aware of. That'll be something that I'll have to learn more about, or maybe the chamber can jump in on that one as well. But I have not heard additional information on it at this point.
Okay, and so Natalie, you don't have any more questions? Okay, so you know what we can do here is if anybody has something final to say before, and we can shut this down tonight. So go ahead, if there's something you'd like to say, you have your last word for tonight.
I just want to mention that we're, yeah, okay.
No, take it away.
We're hosting Emily Rutherford over a luncheon event with
Yeah.
Minister Wilson. So that will be coming up on April 9th, as well as we have Ken Colby coming back to speak at our AGM on May 6th. So if you do have questions prior to that time, just send them our way and we'll ensure they get answered.
Thanks, Jen. This is the best thing about Zoom is like nobody, like how do you get anybody to step forward at the right time? So go ahead, Brad.
I was going to say something similar. I'm looking forward to that with Minister Wilson as well. But also a few things that Ken had touched on is that there are signs in the economy where there are some sectors that are showing strength and growth. We do have some good projections for employment growth and GDP growth in this province. I know it had to take a large dive in order to get a 7% increase coming back up, and that doesn't. That's not an instant relief to business owners that are struggling, but we always try to maintain some level of optimism. And some of the points I made earlier, Leduc cinemas, your points on being able to open are very valid, and I brought that to the government. And the same points are, the last few of those restricted small businesses should have a chance to generate revenue, in my opinion, and that we need to set people up for success over the next 90 days. The variant is going to continue to increase, and hospitalizations will follow that. But at the same time, we need to make sure that people are participating with contact tracers and that they have rules that they're able to follow, because the fatigue level is quite high, and you can, I can see it, around my own neighborhood, is that not all the rules are followed that as closely as they probably should be. But I get it. Like it's tiring, it's exhausting to do this. But we're almost there. Like there's been some good announcements around vaccination supply with AstraZeneca coming in. Pfizer has announced an additional 5 million doses and their schedule moving up as well. And all of these things are going to help. And as we get through the vulnerable population on vaccination, we will see, I believe, case numbers reduce, but also the severity, the hospitalizations coming down and the fatalities coming down as well. And that will help lead the government to ease restrictions at the same time. So reach out if you have any questions. Happy to hear the situations that you're in, and to be able to help you navigate the government or advocate to them as well. Thanks.
Thanks, Brad. Dr. Sakura, I'll let Dr. Sakura and then we'll get to you, Harold.
I think we have to stay the course. So stay home when you're sick. Don't touch your eyes, your mouth, your nose. Wear your mask. Take all those steps to protect yourself, your family, and your coworkers, and keep your households happy and healthy. Take care of the kids. Checking on your loved ones, checking on your older ones and more elderly ones, and checking on each other just to make sure everybody's doing all right. because this is a very stressful time. We are in a race against the emergence of those variants, and we have a tool this year that we didn't have last year, and that's vaccines. We're in the process of getting those out and protecting our population. Just, it's going to be a little while longer.
Yeah, the light's at the end of the tunnel. Harold.
Oh yeah, like I've been quiet for over an hour, which everybody knows is a strange thing for me. Yeah, definitely, even in this house. One thing though, I did want to say, add some positives. It kind of builds on something that Ken Cobley was talking about as well. Right now in the city of Leduc, we have a number of our sectors that have been showing some really strong revival, some strength during this time. It's been mentioned a number of our agriculture type products that are going on projects. We also have a lot of permitting that's going on. In fact, an incredible amount of permitting applications are coming into the city right now. So the one that's always gets me excited, I know, and again, kudos to MLA Rutherford and our mayor, is that the Food Processing Development Center has broken ground. One of the things about the winter we've had is it's allowed that construction to begin already. So if people are driving by there, they can see that construction going on. We've got other things going on with logistics, and I can say that a number of companies, including a couple I've been dealing with that are in the oil and gas supply and service side, are also getting more interest on the export part. So we've been doing a lot of work with some of our companies here on helping them get into the export markets. So while a number of companies are struggling, a number of small businesses, and that's one of the reasons why, to go back to that very first town hall that we had in December, when we brought out the COVID recovery grant, to help those companies that are suffering right now to be able to access the type of funding, the access to the type of support that is there. Sometimes the support, I thought Melissa was bang on what she said, is just sometimes just listening to what they have to say and giving them some advice, cash flow wise, access to capital, whatever that is to get them through. But again, with our partnership with the Chamber and the DBA, the COVID recovery grant was such a solid one for those. So again, there are some longer term challenges ahead. But we're seeing right now business licenses being applied for, permits for new areas. There's a lot of positive that's out there, and it's important, as it's been said, to hang in there. There's a lot more time to ride out some of these things, but as far as a lot of the economic development indicators are, it should be good on balance.
Thanks, Harold. Melissa.
Just to add a little bit to Harold too, if there are people out there doing the export side of things, Export Development Canada has a huge mandate right now. I'm just working with them on a big mining project that's going to be exporting to the Dominican. Their mandate right now is to help businesses with the export world, which also doesn't necessarily mean out of Canada. Export Development Canada is working a lot with the oil sands type stuff. So if you are doing something that is in that world, reach out to them, because that's their mandate, to help you get that financed, to help you get that insured and bonded, to make sure that you're getting your money. Because that's another thing. Sales are great unless you don't get paid.
Thanks, Melissa. Ken, final words?
Yeah, just a couple. Again, thank you for the invitation to this. I always enjoy coming to events in Leduc. And with the local chamber. And I too am astounded that Harold Wilson managed not to say a word for an hour and 45 minutes.
I know, we should have had a clock on it. It's probably a Guinness World Record. Shadia, did you have anything you wanted to say?
No, I just wanted to thank everybody. Thank you all so much for allowing me to be a part of this conversation. It was wonderful. You guys are just a great group of people. I'm, again, just so blessed to be in such a supportive community. So I just wanted to say thank you so much. I really appreciate it. And I look forward to opening those doors and having you all come and visit us at the movies. Yes. Thank you.
Yeah.
Thanks,
Shadia. And that's one of the things, like the pandemic has really put a focus on our relationship between the City of Leduc and small businesses, the Downtown Business Association, the Chamber. And I know that you know, that the pandemic has been terrible, but have been some good things that have come out of it. And I think the relationship that we have, the partnership that we're forming through this, I think it's going to really benefit us moving into the future as well. Once we get rid of the pandemic and put COVID behind us. So, you know, I know that the other night when we were listening, I love the DBA, you know, and I think it's really helpful for people when, you know, you get together on these Zoom meetings and you get to share your stories. And I know that we don't always have anything we can do to help, but I think just listening to people, you know, talk about the hardships they're going through and all that, I think that, you know, maybe that's the best we can do right now until COVID is actually gone. But, you know, one thing I will say is that you know, we've been listening to a few of these now, and I think that people can start to see the light at the end of the tunnel, and there, you know, there's actually a little bit of hope in some people's eyes. And whereas like 5-6 months ago, there's some people I think that didn't see any hope moving forward. So, you know, like I say, I think we are coming out of this, and I want to thank everybody here tonight for coming out to help and answer some questions. And, you know, again, anybody listening, if there's something that we didn't get to tonight, send us an email or send us a text, and we'll answer your questions. So thank you, everybody. I really appreciate you for taking a night off, just like the Oilers did. It's good. So thank you so much.
Alrighty, thanks. Bye-bye.
Bye.
Thank you.